Good morning, friends from the media. Welcome to the 11 o'clock press conference on COVID-19. Apart from the chief executive, we have the secretary for security, the acting secretary for home affairs, as well as the CE of the CHP. Well, because of the epidemic situation, please stay socially distanced and keep your masks on. We'll first hear from the chief executive. Good morning, everyone. This morning, together with the Secretary for Security, the acting Secretary for Home Affairs, as well as the controller of the CHP. We're going to talk about our appeal to get tested every day this weekend, that is between the 8th and the 10th. I would like to take this opportunity to give you an analysis of the overall epidemic situation. The last occasion when I made use of the slide to give you an analysis was the 21st of March. It's been more than half a month. I've had some data updated as well as some charts added to it. Every day at 4:30, the CHP will announce the number of test positive cases for the day. Well, from the 21st of March, it stood at 14,000. Yesterday, it was 3,254. And the number of confirmed cases from PCR and RAT are similar. I would like to remind you that before the fifth wave, the highest daily figure of confirmed cases was less than 100. So you may feel a false sense of security with the dropping in number of cases. However, the number of cases is still quite high, so we should remain vigilant. Well, this slide shows you something that we have done really well. There was an award for invention from Geneva. Our sewage surveillance program has been given its due recognition. Using a 2-day geometric average per liter of water, well, it has dropped from about 454 units to about 113,000 units. So I dropped by about 3/4. This slide shows the tests done under RTD, restrictions and testing declaration. And in every restricted area, we have identified a dropping number of cases. From half a month ago, during RTDs, we picked up about 5.5% of preliminary positive cases. And on the 4th of April, the percentage has dropped to 0.45%. That means that we've only identified 8 preliminary positive cases in the RTDs done over those few days. This slide shows you a different figure. This is the percentage of positive cases identified by community testing centers as well as mobile stations. Half a month ago, we have relaunched CTN, compulsory testing notices. That means the number of tests done under the CTN has increased. Currently, it's about 80,000. It's about 80,000 a day of tests that we have done. Half a month ago, it was the positive cases were 7.35%, and it's now dropped to about 4%. In this slide, you already have the figure announced in the daily 4:30 press conference. The hospital authority announced the number of cases picked up during admission screening. That means the patient is admitted not for COVID, but for other reasons, say, for example, emergency cases or for surgery. The number of cases picked up by admission screening was 53 half a month ago and is now dropped to 4 patients. At the time of the admission screening, if they turn out to be positive, that there might be difficulties because the patient might have been sent to a ward, and patients in the same cubicle or ward will be classified as close contacts. And medical staff members who have taken care of him, and if their PPE was not perfect, then they might be classified as close contacts as well. And this in turn will affect manpower. This slide, table 6. Well, this is an incident rate. On the 3rd of April, I talked about a study of rapid tests done over 3 days. And in this study of 10,000 people, the objective was to identify the incidence rate, the infection rate. They use RAT kits. The figure includes people who have previously been infected but have yet to recover. So the antibody was still present. Previously, it was 1.82%, and yesterday the figure has dropped to 0.31%. That means 3 people out of 1,000. But I'd like to say that the percentage changes. It has increased and dropped previously. For this table 7 is the effective reproduction rate. That means how many people will be affected by one single individual. Previously, it was about 5 or 6. That means one person would transmit the virus to 5 or 6 people. The latest figure is 0.6129. There is a time lag. So the figure is as at 29th of March. But this is on the increase, which causes concern. Maybe because of an increase in activity, it has increased. At one point, when it was at its lowest, it was 0.389. The last table or figure shows us whether there are indeed more people circulating in the streets. This has been verified by our Transport and Housing Bureau. Previously, the Hong Kong U would use Octopus card travel data, and now we use other information to measure the number of people who went out using franchise buses, MTR, tram, and ferries. On the 21st of March, it was 4.78 million, and the 1st of April is 5.44 million, and it hasn't even covered the public holiday we had just yesterday. So figures 7 and 8 are causes for concern. And it also shows us that it is not time for us to relax our guard yet.
And earlier I said that I would like to have a daily RAT test from the 8th to the 10th of April. There are 3 objectives. First, we'd like to have a take stock of the infection situation, COVID infection system in Hong Kong. It's just taking a snapshot. At a particular time, we would like to know how many people in Hong Kong have been affected. But many of them are asymptomatic. That's why we don't know. And we would therefore like to know what has happened, and then we can implement measures accordingly. This is a sort of a survey of the number of infected persons in Hong Kong. And also, secondly, we would like to let those who have been infected aware of their situation, because for the Omicron variant, there are many asymptomatic patients. So through this RAT that has, they will know that they have been infected, and they can make a report, and then we can make suitable isolation measures. And then they can also pay a particular attention to their own behavior and reduce the risk of transmitting the virus to their family members. Our experts are of the view that this will be effective in cutting the transmission chains in the community. And then the third objective is that for those who are not accustomed to the RAT, they will get used to the use of RAT as a test methodology, so that in the future, if we relax our rules and but for specified premises, we may need those who visit such premises to go do RAT first. If we are to ask for, if we are to look at RAT required on a regular basis, we talk about care homes, residents, and staff, as well as construction site workers. So the construction site workers have to do this regularly. And in the future, we also cover the DSA candidates as announced by the Education Bureau. So this is a warm-up exercise for future RAT. And after the announcement, the response from the community is very good, because according to experts, this is a low-cost test tool for to fight the epidemic. And we have actually distributed the essential COVID packs to residents. Acting SHA would talk about the details. There will be 20 RAT kits in each pack. For those who need more or who have not received one, they would be able to go to one of the 90 distribution centers in Hong Kong to get a pack. And Mr. Chen, the acting SHA, will tell you more details. Well, what we need now is to do more publicity. I'd love to show you an API. The first one is on how to use the RAT kit. The second one is an appeal. Starting from today, that these two API clips will be broadcast widely through our websites and other channels. Before you do your RAT, you have to read the instructions, follow each step in the procedure. First of all, clean the table surface, and you have to insert the swab into your nostril, make the terms as required, and then mix it with the test fluid. And then after this done, drip the test fluid into the hole of the test results sure, and then dispose of the material later. If there's one line, then it's a negative result. If there are two lines, it's a positive result. You have to report a positive result to the CHP within 48 hours. Do this as early as you can so that you can protect yourself and your family. And let's have the second clip. To control COVID-19 and cut the transmission chain so that we can resume normal life. from the 8th to the 10th of April, let's do the RAT on a daily basis so that to protect everyone. You have to report the positive result within 24 hours to CHP so that suitable isolation and quarantine measures can be implemented. Let's all work together to fight the epidemic. May I now invite the acting SHA to talk about the distribution of anti-COVID kits to Hong Kong people. In all the 18 districts in Hong Kong, we have already distributed 2.65 million packs. 116,000 were delivered by hand to families in the community. We will more or less completed the first round of covering 2.7 million households 2 days ahead of the original timetable. For those who have not yet received a pack, please go to 89 distribution centers in Hong Kong, starting from the 7th of April. In every pack, there will be 20 RAT kits, which will be sufficient for everyone to do the RAT test from the 8th to 10th of April. I will call upon the public to participate actively. But if anyone has used up all the test kits or haven't received any pack, or they need more test kits, starting from tomorrow, they can go to our so-called refilled distribution centers to get new ones. We have volunteers there to help people in need, especially in respect of helping elderly people using the test kits. If the result is positive, then within 24 hours, you should follow the instructions of the CHP and make a report. After that, the OGCIO would deliver another pack to you, in which there will be proprietary Chinese medicine, Panadol, and face masks, and also RAT kits, thermometer, as well as an information kit on how to deal with COVID. And there also be a booklet on how to deal with COVID during quarantine or isolation. The OGCIO has the capacity to serve 50 to 60,000 people a day. In order to complete this round of tests from the 8th of 10th, they have arranged a fleet of logistics team to ensure that the system will have the necessary quantities of supplies to meet demand. For those who have to do home quarantine or isolation, or if they need more information, they can dial 1-833-019, which is a HAB hotline for queries. We will do our best to meet your requirements. If you can haven't report positive cases, we can also refer their cases to the CHP for action. If necessary, we can also deliver food packets to these people. We can deliver 7,000 packs to 2,300 families at most. And we have actually delivered more than some 84,000 food packets and anti-COVID packs. And for urgent cases, we have a team of workers which can complete this within the same day.
I'll now defer to the controller of the CHP about declaration made using the platform. I've used this chart before. Well, starting from the 7th of March, we have already launched this online report platform. For daily report number, we see about half of the cases reported to us being RAT tests. As at the 5th of April, we have recorded PCR positive cases at 732,622 and RAT positive cases 432,561. Our objective is for early identification, early isolation, and early treatment. According to our tiered treatment and isolation strategy, we hope to provide medical support to positive cases. We will also give them support at their home and also certificate to prove that they are under isolation. We have tested the system. It's very easy to use. Um, you can do it at home, and you can help your family members to do it. In a lot of care homes for the elderly, staff members also carry out these tests for residents every day. Apart from the clip you saw just now, here's some information of how to enhance the accuracy of the tests. We've drawn reference from overseas approaches and advice from overseas experts. If the test is done early in the morning, then the test is more accurate, because overnight you would have your body would have accumulated mucus in your nasal cavity. And after you've done your test, if it is positive, then you should stay at home instead of going to work. And that the timing is very effective in the stopping transmission. Another thing is that you should blow your nose before you do the test, so that any discharge will be pushed to the front of the nose. If you have a positive test, please pay attention to the following. First, take a picture of the cassette, because it's very useful in furnishing information in your report. Stay at home, don't go out, and make use of our online report system. There is a telephone number for you to make inquiries. Is 1836319. You only have to leave us your ID card number and your telephone number for us to call you back. Of course, if you can make the declaration online, you'll be contacted very swiftly. If you do it online, there are 2 steps. First, to provide your personal information online. That includes the domestic settings, your symptoms, as well as the information of those living in the same household. When you fill the information, you'll receive an SMS. Use the link embedded in the SMS to upload your RAT cassette photograph and your proof of identity. Then you will be able to obtain your isolation order immediately. If you've given us your family members' particulars, then they will also get an SMS, and they can upload the information to get the quarantine order. We will, according to the information furnished, conduct risk assessments and make corresponding arrangements. The first thing we do is to pick out the high-risk people. That is, those who have serious symptoms or have some alarming symptoms. We'll ask them to go to the A&E symptoms. These alarming signs include high fever, over 38.5 degrees for over 2 days, shortness of breath, breathing difficulties, not lucid, abdomen pain, chest pain, and dizziness. And for those who are pregnant for over 24 weeks, and if the fetal movement has reduced, then you should go to the A&E department. If you suffer from diarrhea and sore and stomach pain for more than 2 days, you should also seek medical help. From what we have observed, most people have a stable condition, especially if you are vaccinated. But sometimes, if For some people, they will need extra care. For some people, they are asymptomatic and they have the suitable domestic setting, then we will allow them to be isolated at home and the family members can stay at home for their quarantine. As I've said that the infected person as well as their family members will receive respective supplies kit to help them. I'll now elaborate on the online declaration system. From positive test to the submission of report and the issuance of relevant orders, it will only take 10 to 15 minutes. The first step to the declaration system is a brief introduction asking you to keep the cassette photographs as well as other points to note. This system is to be used for new cases. If it's a case that has already been reported, you don't have to make another report again. But there is also a statement about collection of personal data. And it also tells you that if you furnish false information, it is an offense. You'll have to fill in basic personal particulars, your name, your ID card number, your birth date. Your telephone number is particularly important because you need one that can receive SMS. After you have reported your case to us, we will send you an SMS with a hyperlink embedded. We will also make use of this telephone number to contact you. So giving us the correct phone number is very important. The second part is in relation to the test. We ask members of the public to report to us within 24 hours after they've obtained a positive test. We also ask them to take a photograph of the RAT cassette. We also need to know your address. In the future, we may need the information to give us a better understanding of the situation. We'll ask you to give us information about your physical condition. From the Omicron outbreak, we noticed that there are certain categories of people with a high risk. These people may have a higher risk of serious cases or death. And that includes those above the age of 70, those under the age of 5, those who are pregnant for over 28 weeks, and immunocompromised people. That includes those who have received immune system treatment, those who are on AIDS treatment, or those who are receiving hemodialysis. If you are someone from the high-risk group, then we need to ascertain whether you can take care of yourself, and should your situation deteriorate, whether you'll be able to seek medical attention immediately. If you are not able to do that, then it's better for you not to stay at home for isolation. But if you are not a high risk person, then we will see if your domestic settings allow you to be isolated at home. We'll ask the infected person whether there is any communal kitchen or bathroom facilities, say, for example, subdivided units, partition flats or cage homes, etc. Because of the high transmissibility of Omicron, we think that people living in such domestic settings are not suitable to be isolated at home. They'll be sent to isolation centers. And if there are other people in your household, will there be a separate bedroom for the infected person to be isolated? If the answer is yes, then isolation can be done at home. If not, then the risk of transmitting the virus to your family members is quite high. Thirdly, we'll ask about your bathroom because, the virus may be spread through excrement of a body. If there is a separate bathroom, it's ideal. But if there is no separate bathroom for the infected person to use, then we'll ask if thorough disinfection can be done after each use by the infection. If the answer is no, then it increases the transmission risk. The fourth question we asked is that if there are high-risk persons in the same household, that is those above the age of 70, under the age of 5, those who are pregnant for over 28 weeks, as well as immunocompromised person. If there are such persons in your household, then the risk of serious cases, should they be infected, is high. And in that case, then it's not suitable for the person to be isolated at home. After receiving the information, then we will make an assessment as to what arrangements should be made. At the bottom of the slide, you will see that some people may have to be sent to a community isolation facility for appropriate services. The second scenario is that they may require a household member to accompany them, say, for example, to take care of them. And in this case, we may may make appropriate arrangements. The third scenario is that they don't have anyone to take care of them and they need assistance from the government. We will provide the service to them. And the fourth scenario is that the domestic setting of the infected person is suitable for home isolation, and as a result, you may ask to be isolated at home. And then we will decide whether to take appropriate measures to mitigate the risks. After submission of the questionnaire, you will receive a reference number and also the date of submission.
小時
We can roughly handle 60,000 reports per hour. So even if there's a lot of reported cases, which you can handle them. After you have furnished the information, you will receive what you see in the SMS on the left-hand side within 3 minutes, saying that your information has been received, but you need to log in and provide the relevant information. There will be a link. What you need is the 3 pieces of information: ID number, or contact telephone number, and also that is the number for which the SMS will send. And then the next step is the last step: upload the relevant documents, Hong Kong ID, and also the RAT positive proof. And after that, the information is provided, you can download the isolation order. Some people may like to get the isolation order through a desktop computer, so that there can be a printout version. So they will be allowed to download the same document within 30 days. This is the isolation order, which will take immediate effect upon issue. The transmissibility of Omicron is high, especially in a household. So for high-risk people, we would adopt different measures, specific measures for them. There will be a tiered triage arrangement for isolation and treatment. There are 5 tiers. First and second tiers would require hospitalization. For example, the medical conditions are unstable. They may need to be sent to an isolation ward. And also for critical patients, they may have to be admitted to an ICU ward. For those who are more stable, they would be sent to North Lantau Hong Kong Infection Control Center or community treatment facility. Most of the people will belong to Tier 4 or Tier 5. For Tier 4, they have no obvious symptoms. They don't need specific medical support, but because of the needs arising from their household conditions, they need to be isolated outside their home, where they can be sent to special facilities or holding center for the elderly, or alternatively, they may need to be admitted to a facility accompanied by a family member. We're talking about individual units in the isolation facilities. And then thirdly is the general isolation facilities. For those who are who do not require to be sent to any facility, they will do the whole quarantine at home. They have no obvious symptoms. They don't need medical support, and they do not live in cubicle or subdivided unit. And the family members are not high-risk people, and they would, if they are not able to do home quarantine, it's either because they have high-risk family members, they have to share the facilities such as the bathroom or kitchen. They don't have separate bedrooms for the infected persons, and they don't have separate bathroom, or they cannot disinfect the bathroom after use every time, or they have other high-risk family members living in the same household. All right. For those who have been issued an order to be admitted to an isolation center, the reception and transport will be arranged by the Security Bureau. Now the Secretary for Security would tell you more about the details. The controller of CHP has just tell you the tiered triage system. Some will stay at home for the quarantine, and some will be sent to government specified isolation facilities. When the D of H has decided that some of these people will need to be admitted to a isolation facility, an isolation order will be issued for that purpose. The Security Bureau will act in accordance with the isolation order and contact the person over phone and inform them of the relevant procedures to follow. And the fire services department would send a vehicle to take them to the facility. I have to remind everyone that the isolation order is a legally binding document. And if you are issued with an order, you have to go to an isolation facility as required. Otherwise, you have to show the legal responsibility for the breach. For those who are tested positive, the Department of Health would This is just an alternative option offered to those who have been tested positive. If they want to go to an isolation facility, they can dial the relevant numbers and make the arrangement. For the isolation facilities built with the support of the Central People's Government, there are already 6. There have been smearing messages concerning these cabin-styled quarantine isolation facilities. So I would like to show you what's really included in these facilities here.
Thank you. I'd like to thank the central authorities and the Hong Kong SAR government.
係大家喺
From the clip, you can see the actual situation of the makeshift isolation facilities. We make use of small community management. There will be management of 30 to 50 units in one section, and assistance will be provided to those who are staying there. Our approach is also people oriented, and it started when you set foot in the isolation facility. You only have to give us simple information, and then you'll be led to your unit to settle down, and you will make use of QR code to fill out the information. For those who are not familiar with the use of QR code, we will have someone there to help you. In every unit, we will arrange for those from the same household to stay in there. Under normal circumstances, you won't need to share your unit with someone outside your household. Apart from basic supplies, we will also provide basic entertainment, say for example, magazines, newspapers, online entertainment activities, and also toys for children. We have sufficient supply, and we don't want to deliver cold food to those staying there. So we have received, by way of a donation, some steamers for one to reheat their food. For those who are mobility impaired, we have also turned golf buggies for their use. When they leave the isolation facility, we will send them by way of transport to the nearest bus stop, bus terminus, or NTR station. We try to be people-oriented as much as possible and to show them that we care. We'll now take questions. Please raise your hand when you're named. Identify your organization and make use of the microphone we give you. Keep your questions to 2 to 3. The lady in the middle towards the back. I'm from Now TV. It's rumored that today, John Lee, the Chief Secretary, will resign to sign up for the CE election. Have you received his resignations? Have you heard anything from him yet? And it's hotly rumored that there will only be one candidate this time. What's your take on this? Because when you stood for the election, there was competition. If there's only one person, how do you convince the public that it is a credible election? I'd also like to ask about universal testing. Have you set any objective as to the number of people who should participate? There are also a lot of recovered patients in the community. There is no incentive for them to take part in the RAT test. And what more can you do in your appeal? Well, I have not yet received any resignation letter from any officials when I left the office to come here, and I will not comment on the chief executive election. In relation to the territory-wide RAT test between the 8th and 10th of April, I ask members of the public to participate. I've already told you our objective. There is no need to make a report if your result is negative, and the entire exercise is voluntary. All we can do is to keep on appealing to members of the public to participate. If you identify with our 3 objectives, then please do it. It's a very easy test, and it will only take a few minutes of your day. In relation to recovered patients, I will defer to the controller of the CHP. Just like other tests, well, currently we have over 1.1 cases, accumulated cases in our community, there is no need for them to do any tests. However, if they have any symptoms, it is better for them to do the test for added protection. If they have done the test, if they have made the report, there is no need to make another report over those 3 days. Another reporter, the one on my left towards the back, the gentleman. I'm from Phoenix TV. Some doctors said that members of the public may not want to go into the community isolation facilities, so they won't report even if it is positive. And they're afraid that their employers may not recognize the RAT test isolation order, and there won't be any compensation. Are you concerned that this may dampen the effectiveness? And in relation to the 90% target of vaccination, well, you reached that target a month ago, and the latest information shows that for the second dose is at 85.3%. When do you think it will reach 90%? And for the past 2 weeks or two, for the vaccination rate amongst those between 3 years old and 11, well, it has only increased by 4 percentage points. Do you think that you will be able to resume face-to-face classes in April? We've made preparations for the RAT territory-wide tests. We want to dispel any concerns, any uncertainties. That's why we've given you more information this morning. If you've listened to Dr. Choi's explanation, you see that for the entire system is risk-based. An assessment will be done on the situations of those who are tested positive. There is also a tiered strategy and also a triage system. So I don't see any reasons why I should be concerned about what you said. That is in relation to people refraining from reporting their case because they don't want to be sent into community isolation centers. And I'd like to also say that some previous reports about the condition in the community facilities were false. And as you've heard from the secretary, we use a people-oriented approach. So if it is assessed that the person is suitable to be sent to an isolation center, the CHP will issue an isolation order, which should be complied with. For someone who would like to go to an isolation facility, then the person may make use of the SMS sent by the Fire Services Department to ask to be sent to an isolation facility. You may ask me what incentives there are for one to do the RAT test and report the positive result. The biggest incentives are the 3 objectives I've outlined. You only have to take a photo of your test cassette, and then the government will be in a better position to gauge the general situation for resumption of classes as well as relaxation of social distancing measures on the 21st of April. Most cases of Omicron infections are asymptomatic. You would like to monitor your health conditions, say, for example, take your bodily temperature. But if you take the test, then you know whether you're infected with Omicron so that you can better protect yourself and your family. The third thing is for members of the public to be familiarized with the approach, because when the epidemic situation stabilizes and lives have resumed, have become normal again, then it will be very easy for them to do the test as and when needed. And if you've heard from Dr. Choi, there is an isolation order issued, whether you are being isolated at home or at an isolation facility. You will receive an isolation order. The isolation order suffices as a means of proof to obtain sick leave under the employment ordinance. A bill has been introduced to LegCo to amend the employment ordinance to clarify the situation. Well, if you are an employee and you would want to participate and you fully understand that if you are positive, you have to be isolated, whether at home or at an isolation facility, then you will be able to obtain the isolation order as a proof of sick leave.
The second question is about vaccination. I have to make appeals continually for this to be done so that we can return to normal. But one of the requirements for students to resume face-to-face classes will be for vaccination status. According to the directive issued by the Education Bureau, that there may be different treatment for those who have been vaccinated and those who are not when school classes are resumed or when certain activities are conducted. But it is not that those who have not been vaccinated will be barred from returning to school. But we can see that the vaccination rate is rising rather slowly. We're not concerned about the second dose for those who are over the age of 12, because according to past experience, once you have received the first one, they will certainly usually get the second one so as to complete the vaccination. And many people only receive the first dose after the start of the fifth wave. So you need to, there's an interval and for the first and between the first and second. So we have achieved a rate of 86%. We have every confidence that it would go above 90%. For those in the age group of 3 to 11, the rate is just 60%. I would like to appeal to parents that they should make sure that their children would get the same treatment in terms of activities or playing sports. So when they return to school, please arrange for the children to get vaccinated so that they can be adequately protected. For the elderly, we have taken different some special measures. For example, making appointments for outreach teams to go to their residents for vaccination. So I appeal to all members of the public to support the vaccination program.
China Morning Post.
Oh, sorry, could you speak louder, please?
English questions from the South China Morning Post. Good morning. Mrs. Lam, first we'd like to ask a few questions about the election. So the Hong Kong, Macau and Macau Affairs Office has not acknowledged or commented on your decision not to seek a second term. So how do you view this lukewarm response to regarding your decision not to pursue a second term? And can you also clarify whether you have received any resignation letters from your cabinet members at the moment? And the next questions are concerning the pandemic. So for the Secretary of Security, is there enough CIF units for people whose home accommodation is not suitable for isolation? And for you yourself, there are reports that you may also pursue the next level to be the Chief Secretary. Are these comments founded or baseless? And there are also comments that the distribution of the pandemic care packs have not been ideal at subdividing the housing units. How can people obtain these packs if they don't have the slips in their mailboxes or delivered to them?
There are three sets of questions. On the first set of questions about the sixth-term chief executive elections, I said as a general rule I will not comment on the elections, but I can only confirm that up to this moment in this auditorium, or before I came into this auditorium, I have not received any resignation letter from any of my principal officials. I can also answer part of the second question directed at the Secretary for Security, and that's about capacity. In fact, one of the reasons why we proceed with this rapid antigen test for every member of a community at this point in time is our confidence in capacity. Over the last 2 months or so, with the support of the Central People's Government, the Hong Kong SAR government has significantly enhanced the capacity almost at every stage of our anti-epidemic work. And of course, the cases have come down quite significantly. So with the combined situation of lesser cases and more capacity, we are very confident that even if this 3-day daily RAT were to give rise to a large number of positive cases, we will be able to handle it. Now, I can give you some illustrations of our capacity. One is we have a very sufficient stock of the rapid antigen test kits. We have already distributed through the 3.5 million service bags, a total of 70 million kits. We have more to supply at the various service stations that I will invite the Acting Secretary for Home Affairs to tell you again in English. And many of these supplies also were procured with the support of the central government. Second is we have a very well tested online self-declaration system that the controller for the Central Health Protection has just updated you. It could handle every hour 60,000 self-declarations. Thirdly is for those who have been tested positive and allowed to stay at home, we have a very well tested and effective delivery system to deliver to them this anti-epidemic resource pack. At the peak, the teams could distribute or deliver 60,000 bags to families every day. Of course, now it's down to several thousands because the cases have come down. And fourthly, we have a very strong fleet of designated taxis to transport infected persons from their home to the community isolation facilities. Now, in terms of your specific inquiry about whether we have enough CIF, the community isolation facilities, I would tell you that we have a lot. We have 20,000 beds. Maybe we don't even need to use the beds. We will allocate by rooms in the 6 sites built with the support of the central government. We still have a certain number of CIF hotels. We have a block of public rental housing, and we have Penny's Bay. And we have 6 or 7 holding centers, which could also serve the purpose of a CIF for elderly people. So in totality, we are confident that we have enough. And then if people were allowed to stay at home for isolation, we have a very strong home support scheme, including 23 designated clinics and again, designated taxis to take people to the clinics, and the delivery of various supplies, including food items that this Acting Secretary for Home Affairs have told you. And for those who are critically sick that need hospital admission, even in the very strained hospital authority hospitals, we now have more beds. We have beds waiting to treat COVID-19 patients. So you need not worry about our capacity. We have the capacity, and that's why we are proceeding with this very meaningful and useful exercise. I will now invite the Acting Secretary for Home Affairs to respond to whether the distribution of service bags could be improved and where are those additional supply centers. And I will leave it to Secretary for Security whether he wishes to answer your question. Thank you.
Thank you, the Chief Executive. For the distribution of these anti-pandemic service beds to some 2.7 million households in Hong Kong, we have a very detailed plan and also very extensive distribution network. Our distribution plan has 2 stages. the first stage was to distribute all these beds to housing units, including private housing and also public housing, and also the 3 new buildings and also in the new territories. First, we sent out or delivered all these beds to the housing department for their onward distribution to public rental housing units, and also to the property management companies for them to distribute to individual housing blocks. We have, as I said at the opening, we have already, as at yesterday, we have distributed 2.65 million beds out of 2.7 million households in Hong Kong. And we have confidence that by the close of today, we'll be able to distribute all these beds to all 2.7 million households. That means shorter than our original plan of 7 days by 2 days. And for public housing estate, there are about 840,000 public house rental units in Hong Kong. And as I gathered this morning from the housing department, we have already 90% of these public housing rental units have already received the bed, so 90%. And for private housing estates, we have also information from our network that all these major private housing estates have already distributed these beds to the residents, including like Tai Kwu Sing, or South Horizon, 海怡半島, or 將軍澳中心, 維港灣畔. All these private housing estates have already distributed these beds to the residents. And over the last 4 days, we have also distributed 110,000 beds to 3 new households individually. So the distribution is very smooth and effective. But for those who, for all sorts of reasons, who have not received the beds in stage 1, they can, starting from tomorrow, go to our backup station. There are altogether 89 backup stations in 18 districts. And starting from tomorrow, they can get their beds from those backup stations. So to conclude, very effective, very extensive network. Thank you.
Chris? Okay, thank you, CE. Regarding the questions about myself, I think I enjoy being S4S, and I will focus my work as S4S. And regarding what's next is not on my own agenda. Thank you.
咁我哋今日問多最後一位記者提問咯，最前排。
Last questions from the reporter, the gentleman. I'm from Hong Kong Economic Journal. First question is about the universal RAT test. If someone's tested positive without reporting, are there any follow-up actions taken? Or is it just an honor system? Well, we are 1/3 into the nomination period of CE election. So far, there are no valid nomination. Is it normal? Well, you've been sanctioned. Your salary is stored at home. When you step down, what would happen to your everyday life? Would there be difficulties? Will a former CE's office provide you with assistance? And an EXCO member yesterday on the radio said that you are quite heavy-handed. You don't have any friends. Previously, you mentioned about family reasons, and that's one of the reasons why you won't seek an election. Is that the case? There will be rigorous follow-up actions taken when people have obtained a positive test and in relation to making a report. In relation to the 6th CE election, I don't have any comments, and it's not appropriate for me to make any comments. And I thank you for your concern about my personal life, but I'm not going to answer such a personal question. As to how other people assess my work, well, we have freedom of speech here. I'm not going to comment on that. Doctor, when we receive a positive case, we will conduct random checks. Starting from the 7th of March till today, we have about 29 cases when we have checked. We use the golden standard, that is a PCR test. A small number, that is about 1 to 2%, was found that the first PCR test is negative. We'll take follow-up actions to see whether it is a false positive or whether the information furnished is misleading. There are 3 cases when we might take follow-up action because there may be false information furnished. And if you get a positive test, we would ask you earnestly to report your case. It is a voluntary declaration system. As we've said, that if you give us the information, it will help us in many different ways. Say, for example, when we will provide you with suitable support, if we identify high-risk cases, then we will make use of a patient support call center to approach directly the infected person. We might make arrangements for face-to-face consultation at designated clinics. If it's a case reported and if there is a need to use Chinese medicine, our Chinese medicine team may also get involved. Once a report is made, relevant documentations will be issued. I hope that everyone will understand that making a report of the positive case will be of great assistance, and it's very useful and also reduce transmission risk. Sorry, speakers off mic. The interpreter cannot hear. The speakers off mic. That's why we keep making an appeal here, and I would like you, the media, to make an appeal for us. We all hope that there will be relaxation of social distancing measures by stages starting from the 21st of April. Well, I'm sure that you all want to make use of your consumption voucher to use the evening dining services, to see your friends and families, and to send your children to school. All you need to do is to take a test, preferably in the morning, on the 8th, 9th, and the 10th of April. And that will be an RAT test. If it is positive, then make use of the declaration system introduced by Dr. Choi. We'll issue an isolation order. We'll take into account your situation and make arrangements for isolation arrangements as appropriate. I do think that members of the public are very supportive of our measures, and we will all work together to fight the epidemic. That's the end of the press conference. Thank you.